I'm Marc McCollaum. I'm a physician assistant with master's degree, and I've been practicing for about 30 years. Yeah, we practice regenerative medicine, and we really are taking a look at the complete individual. Sometimes there's a need for a gentle approach. Sometimes you need surgery, but you don't always need a sledgehammer for every job. Sometimes you need a fly swatter, and sometimes you just need to tell people how to shut the door to keep the flies from coming in. One of the first tenets in medicine is, of course, back into the old Hippocratic oath of first do no harm. And we do try to, use therapies that are natural, gentle, and again, the right tool for the right job. And we always try to look for what's going to be for the best fit for the patient. And every patient is treated as an individual. They're not cookie cutter. We don't have one thing and everybody gets the exact same thing. Everybody gets very individualized attention, everything from their diagnostics to their individual treatment plan. About 15 years ago, I was actually teaching at the university level. And one of my jobs was to find rotations for students. And I had some students that came back and they were reporting that these new technologies using stem cells and all the things that it was actually doing for the patients that were coming back to these offices when they were students, and they came back and reported on it. So I was like, this is very interesting. At that time, they were doing autologous stem cells where they were actually pulling things from your bone marrow, sending it to a lab, growing everything up, purifying it, coming back in, and then injecting it back into the patient, and then they were having these miraculous recoveries. So I started researching it, looking into it a little bit more, and then I started seeing some of these patients in my own clinic because I was working one day a week in a private office, and I had one gentleman that came in and said, I'm going to be doing some stem cell treatments. And this gentleman he was probably 75, 80 years of age. He was on a walker. His skin was very ashen, very gray, very poor health. And I thought surely to myself, I'm going to go ahead and make him a follow-up appointment for 6 months. And in my heart, I knew that this was probably going to be the last time that I would see him again. Well, lo and behold, he made his 6-month follow-up appointment and he had a cane. He was no longer using the walker and his color was really good. And he was just talking volumes about this stem cell treatment and what it had actually done for his joints, and also it was starting to reverse some of his heart disease. He had gone from like a stage 3 congestive heart failure down to stage 1 in 6 months. And I was really interested. And then when I had a chance to actually learn and to start working with stem cells, doing some training, I started seeing some amazing things as well. And from there, it's just you learn. You relearn, you unlearn. When we all go to school, we are all committed to not so much as sticking with what they teach you, but you have to unlearn and relearn everything, because as the body of knowledge increases, we have to change the way that we practice medicine. Again, first and foremost, always do no harm. Everybody's going to have a little bit of a different result. Again, these regenerative proteins and the cytokines are going to go all over the body. We have no control of where they're going. We can place them into a joint to get a little bit more of a boost, but they are eventually going to migrate into every tissue in the body. The body, when it's in pain or it has a problem, it sends out like a chemical smoke signal per se, saying, hey, I need some help here. And that is a signaling chemical that is now going to attract those proteins and cytokines to go to that particular area. You may not even know that you had a problem, but it's now going to be going in there to try to fix and address those issues. If you have an area that hurts, those pain signals that you feel the pain, that's actually your body sending out a signal that says, hey, send something over here. We need some reinforcement. That's usually the first thing that we notice that starts to get better is the acute pain improves. The mood changes. You start feeling more energy. About a third of patients will experience a little bit of a mild euphoria where they just feel unusually good fairly quickly, sometimes even before they leave. I've had 2 patients that asked me what I had put in that IV and if it had any alcohol in it because they thought that they had had a glass of wine because they don't drink. We said, no, absolutely everything is completely natural. There's nothing in here. That feeling usually passes in a few minutes. And sometimes they even tell me, I'm actually feeling better. My joint is feeling better when they walk out of here. I had one gentleman that we did some paraspinal injections, and he was slumped over, and he was actually walking tall within 30 minutes of his injections. And yeah, we've seen it work that fast, but it continues to work even initially, or even after the initial injection. That, honeymoon period starts to fade out a little bit, but these things continue to work in the body for weeks and months afterwards. So we've just begun. On the business side, my wife wishes I was home a little bit more. We are completely booked out for the next 3 weeks. New consultations. We don't really do any advertising. Our advertising is done by word of mouth, and everybody is telling their friends, their family members. We're getting calls in. Do you treat this? Can you treat this? Do you have any experience with this? I'd like to come talk to you about, my problem. And I've had more new patients probably in the last 4 weeks. Again, I'm booked out for the next 3 weeks, pretty much solid. As far as satisfaction, I'm tired, but I feel very satisfied. I did not go into medicine with the dreams of ever being rich one day. I live in Golden Gate Estates. I live out in the country. I like the quiet life. And I went into medicine to help people. And for the first time in 30 years, I really feel like I've got something that is really helping people that I feel very good and very positive about. Anybody can treat a strep throat. Anybody can give somebody to make some of their aches and pains a little bit more livable for the day, and you're gonna have to just do it again tomorrow and the next day, and then you hope that you don't give them an ulcer, or you're not killing their kidneys off because of the effects of the medicine. Again, I think I've told you the difference between medicine and poison is dose, time, and application. And we have treatments in medicine. It's very rare that we ever find something that literally has the potential of, I know we're probably not supposed to say this, but treating to the point where the condition is almost non-existent. I don't want to say the cure word. It's kind of a buzzword, but I can definitely see that this is where the future of medicine is going, and I'm very optimistic.